السلام عليكم طلبة المرحلة الخامسة. Our lecture today is about the laboratory investigation. In many cases, after taking of history and doing of extra and internal examination, we cannot reach to the definite, accurate final diagnosis, and we need in these cases an extra means, which are the laboratory investigation, to confirm our suspected diagnosis. This extra investigation divide to hematological tests, biopsy, imaging tests, microbiological tests. Moving to the hematological tests, the first investigation or test is the hemoglobin or HB. Its normal value in male 13 to 17 gram per deciliter, while in female equal to 12 to 16 gram per deciliter. HB increase in case of polycythemia, while it decrease in case of anemia or when there is a hemorrhage. Other test is red blood cell count or RBC count. The normal value of RBC count is 4 to 6 million per milliliter in male, while in female 4 to 5 million per milliliter. Increase means polycythemia, while decrease it mean anemia. 3 hematocrit or packed cell volume, PCV, which are represented by the percentage of the number of red blood cells per liter of blood. The normal value in male 40 to 50%, while in female 38 to 47%. Increased value of PCV means polycythemia and or in case of dehydration, and its value decrease in anemia or in case of hemorrhage or overhydration. 4. Stained blood smear. Sometimes when there is anemia and we need to identify the etiological factor of the anemia, we use the stained blood smear. By seeing and observation the shape and size of RBC, we can know the causative factor. So we have 3 types: normocytic, normochromic. In this case, the RBC appears with normal size and shape and normal level of hemoglobin content. So it appear like normal RBC. So the cause in this case is either acute blood loss, a chronic renal disease, or in case of a pregnancy or cancer. B. Microstatic normochromic. The RBC in this case appear large in size, but with the normal level of hemoglobin content. In this cases, the causes are vitamin B12 deficiency, folic acid deficiency, and in case of liver disease and alcoholism. The last case, microstatic hypochromic. In this case, the RBC appear smaller in size with low levels of hemoglobin content. In this cases, the causes are iron deficiency anemia, thalassemia, and lead poisoning. Mean corpuscular volume, MCV, which is the measure of the average volume of RBC. Its normal value 80 to 95 femtoliter. الفيمتوليتر يساوي 1/10 أس ناقص 15. Increase mean microstatic anemia, while decrease in case of macrocytic anemia. 6. Mean corpuscular hemoglobin, MCH, the hemoglobin content of individual RBC. That means the weight of hemoglobin in each individual red blood cell. Its normal value 27 to 34 بيكوغرام. البيكوغرام يساوي 1 في 10 أس ناقص 12 جرام. Decrease value of MCH mean hypochromic anemia. 7. The mean corpuscular hemoglobin concentration MCHC, which is the amount of hemoglobin in 100 ml of PCV. Its normal value 30 to 35 gram per deciliter. It increases in case of spherocytosis, which is a type of anemia characterized by fast breakdown of red blood cell, and decrease in case of hypochromic anemia. Platelet count. Normal value of platelet count is 150,000 to 400,000 per milliliter of blood. It increases in case of acute infection, chronic granulocytic leukemia, polycythemia, and liver cirrhosis, while it decreases in the case of acute leukemia, purpura, and thrombocytopenia. Total white blood cells count, white BCs count. Its normal value is 4,000 to 10,000 per milliliter. Increase of white BC count occur in case of inflammation, infection, leukemia, while value decrease in case of aplastic anemia or in side effect of chemotherapy or radiotherapy. Differential white BCs count. In this test, we measure the percentage of each type of white BCs. First, the neutrophil. Normally, their percentage is about 50 to 70% of the total number of white BC count. It increase means bacterial infection, oral ulceration, and in case of Hodgkin diseases. Decrease means neutropenia, aplastic anemia, and in viral infection. Lymphocytes. Normally, the percentage of lymphocytes is 20 to 40% of the total white BC count. Its value increase in case of chronic infection, viral infection, glandular fever, and lymphocytic leukemia, while it decreases in case of corticosteroid therapy and whole body irradiation. Monocytes. Normally, monocytes represent about 4 to 8% of total white BC count. It increases in case of acute bacterial infection, TB, malaria, monocytic leukemia, Hodgkin disease, and chronic ulcerative colitis. Eosinophils. Normally, its value nearly about 0.4% of total white BC count. It increases in case of allergic reaction, asthma, chronic granulocytic leukemia, parasitic infection, lichen planus, and erythema multiforme, while it decreases in case of systemic corticosteroid therapy. Basophils. Normally about 0.2% of total white blood cell. It increases in case of ulcerative colitis, leukemia, and lymphoma, while it decreases in case of hyperthyroidism and in case of citrus. 11. Complete blood count, CBC, which include all the RBC related tests, include RBC count and size, HP, PCV, MCV, MCH, and MCHC, and all white BC related tests, which include total white BC count and differential white BC count, in addition to the platelet count. Erythrocyte sedimentation rate, ESR, or plasma viscosity. It defined as the rate at which red blood cells precipitate in a period of 1 hour. It considered as a global measurement of non-specific plasma protein. The normal value of ESR is 0 to 15 millimeter per hour. It increases in case of systemic inflammation, autoimmune disorders, particularly in the giant cell arthritis and Wegener's granulomacytosis, and in case of rheumatoid arthritis. Also, in case of a fall of albumin level and bacterial infection, pregnancy, and in case of malignancy. Now moving to the tests related to bleeding disorders, which are very important for us as dentists, especially for the patient that complaining of abnormal clotting of blood and his blood not clotting at that normal time. So we can send the patient for this test, which include a bleeding time. The normal value of bleeding time is 3 to 9 minutes. Increase than this range means the patient has defect in platelet function or thrombocytopenia, or in case of Wall-Wilpern disease, and in case also of vascular disease. The other test is the prothrombin time. Normal value of prothrombin time is 10 to 14 seconds. Increase in case of warfarin treatment, the patient that taking anticoagulating drugs, or in case the patient has a liver disease or vitamin K deficiency or deficiency of the factor 1, 2, 5, 7, or 10. The last test related to bleeding disorder is the activated partial thromboplastin time, APTT. Normal value 30 to 45 seconds. Increase means liver disease, heparin therapy, hemophilia deficiency, or factors 1, 2, 5, 8, 9, 10, 11, 12. When we have a patient with a severe chronic anemia, and we need to know if the cause related to iron storage or to synthesis of hemoglobin, we use the following tests, which are the serum iron, ferritin, folate, and vitamin B12 level in the blood. The normal value of serum iron is 60 to 175 milligram per milliliter, while the normal value of ferritin in male 18 to 350 nanogram per milliliter, and in the female 12 to 156 nanogram per milliliter. Vitamin B12 level normally in the blood is 12 to 156 nanogram per milliliter. Ferritin, a more sensitive indicator of body store, as we said, of iron than serum iron, and total iron binding capacity. Vitamin B12 deficiency is sometimes associated with recurrent aphthous ulceration and recurrent candidiosis. Blood glucose, fasting blood sugar, normally its value about 120 to 140 milligram per deciliter. It's used in the diagnosis of diabetes mellitus. Right? That's mean for hyperglycemia and hypoglycemia. Serum urea, creatinine, and electrolytes levels in blood. These tests used for diagnosis of renal failure. When there is a renal failure, there is a raised urea level and creatinine level, and there is electrolyte disturbance. The normal value of serum urea is 15 to 50 milligram per deciliter, while for serum creatinine is up to 1 milligram per deciliter. That means above 1 milligram there is a problem with the renal system. Serum liver function tests include measurement of bilirubin, alanine aminophosphatase, albumin, and globulin, which used in diagnosis of jaundice, liver and biliary tract disorders. Normal value of serum bilirubin is up to 1 mg per deciliter, while the normal level of alanine aminophosphatase is 0 to 35 unit in liter or in male, while in female 0 to 20 unit per liter. Serum albumin normal level is 3.6 to 4.5 gram per deciliter. Serum calcium, serum phosphate, and alkaline phosphatase. These tests used in diagnosis of metabolic bone diseases such as Paget diseases, bone tumor, and hyperparathyroidism. The normal value of serum calcium is 8.2 to 10.2 milligram per deciliter. Serum phosphate is 2.4 to 4.1 milligram per deciliter, while alkaline phosphatase normal level is 30 to 80 international units per liter. Serum cardiac enzymes, which include creatine kinase, lactic dehydrogenase, and aspartate aminotransferase. These enzymes are useful in diagnosis of acute myocardial infarction and congestive heart failure. Serum lipids tests or lipid profile tests include cholesterol and triglyceride and lipoprotein. These tests used to diagnosis of hyperlipidemia. Normal value: serum cholesterol up to 200 mg per deciliter, while triglyceride is 90 to 180 mg per deciliter. Hormones. The level of hormones of specific gland will show us if there is abnormality in this gland or not. For example, any defect in TSH means there is an abnormality in the thyroid gland. Urine tests include 1. Glucose urea. This test used to diagnosis of diabetes mellitus. Ketone urea. When there's ketone bodies in the urine, this is an indication of diabetic ketoacidosis. 3. Bilirubin or urobilinogen. Either of these may indicate hepatobiliary disorders. 4. Proteinuria or hematuria may be due to menstruation or indicate urinary tract disease. Normal value of proteinuria up to 150 mg in the day. Moving to the immunological investigations, which also called antibody tests. These tests are performed on serum to measure concentration of a specific antibody against a specific pathogen or antigen. The main reasons for using of these tests are: 1. Confirm of exposure to an infection or foreign agent. 2. Evaluate of protection level, immune status against particular microorganism. 3. Diagnosis of autoimmune conditions. 4. Diagnosis of the reason of transfusion reaction or rejection of transplanted organ. Finally, diagnosis of allergy. Immunological tests include rheumatoid factor, which used for diagnosis of rheumatoid arthritis, would usually be positive in a patient with rheumatoid arthritis. 2. Anti-nuclear antibody ANA. Normally it is negative or its titer less than 1 to 10. It will be positive and high in case of rheumatoid arthritis, Jorgen syndrome, systemic lupus erythematosus. 3. Anti-DNA antibody. normally negative, or it is titer less than 1 to 10, while it is B positive and high in case of systemic lupus erythematosus and Sjogren syndromes, these are in autoimmune diseases. Hepatitis A antibody normally negative, while in the patient with infection of hepatitis A it becomes positive. Hepatitis B surface antibody in normal person it is negative, while in case of patient infected with hepatitis B virus it becomes positive. Hepatitis C antibody also normally negative, and in case of hepatitis C it becomes positive. Microbiological tests. For bacteria we have two important tests, which is culture and antibiotic sensitive tests. These tests is useful for the culture to detect unusual pathogens, for example actinomycosis and soft tissue infection, and in case of a lesion or infection not respond to antibiotic, and to know what is the most powerful antibiotic in the treatment of that infection, we can use the antibiotic sensitivity test for all infections, particularly osteomyelitis and acute facial soft tissue infection. For candida infection, we can use the smear by taking a swab, for example from the tongue, and put it on the slide and to see under the microscope to see the hyphae of candida. Virology. For viral infection, we can use tissue culture, antigen detection of a specific virus, and also identification of genetic material by PCR. Moving to the biopsy, which is an important investigation that widely used in dentistry. It is defined as the removal of part or whole lesion by using of a sharp dissection to avoid crushing of the sample. Then fix it in a fixative solution, which is usually 10% neutral buffered formalin or similar fixative solution, and then send to histopathologic examination. Types of biopsy. Number 1, incisional biopsy. This type of biopsy used usually when there's a huge lesion or widely distributed lesion, so we taken part of the lesion and another part from normal tissue. So this method used to determine diagnosis before treatment. Usually used such in case of white lesion, like in case of lichen planus or leukoplakia. Number 2, excisional biopsy. When the lesion is small, in this case we remove the entire lesion as in papilloma or mucocele, and in this case biopsy used to confirm diagnosis, and excisional biopsy also used as treatment and diagnosis. Number 3, aspirating biopsy. This type of biopsy used for cystic lesions or deep cavities when other type cannot be used. This type of biopsy considered unreliable, and we cannot depend on it for definite diagnosis, but it has some indications, such as to differentiate between benign and malignant neoplasm, or to initiate treatment, or to indicate a need for further investigation. 4, exfoliative cytology, which is examination of cells scraped from the surface of the lesion, and also it does not provide information about deeper layers, so it is unreliable for definite diagnosis. And it is most useful in detecting virally damaged cells, acantholytic cells of pemphigus or candidal hyphae, but it is, as we said, unreliable in diagnosis of cancer. Number 5, brush biopsy by using of a round stiff bristle brush to collect cells from surface and subsurface layer of a lesion by vigorous abrasion. Imaging. Number 1, we have plain radiography or X-ray, which is useful in diagnosis of bone fractures, dislocations, bone and teeth disorders, joint disease, and foreign bodies. Number 2, computed tomography or CT scan, which give integrated information from multiple radiographic slices into images of internal organs and tissues. Usually used for diagnosis of disease in the brain, sinus, neck, orbit, TMJ, etc. In CT, the dense bone appear white, while soft tissue is mid-gray, fat is dark gray, and any other tissue appear as black. 3. Magnetic resonance imaging, MRI. It gives sensitive images of internal organs and tissues, for example, brain, spine, TMJ disorders. Number 4, ultrasound. In fact, it does not involve radiation exposure and give images of internal organs, and usually used for the soft tissue lesions such as soft tissue lump or salivary gland and lymph nodes. Number 5, radioisotope scanning. This type of investigation involves injecting of radioactive compound and visualization of organs with gamma ray. This method used in salivary gland scanning and in bone scanning, for example, bone tumor, Paget disease, and arthritis. Finally, angiography, which involve contrast media. This type consider an invasive procedure and include radio-opaque contrast media injected in the organ that need to examine. This method usually used to determine fistulae and sinuses, and they also used in cerulography, which is scanning of salivary gland, and arthrography, scanning of joints. Thank you for your attention.